took a while for this to happen, and they tried to do it at a time when they thought no one was paying attention. Gotcha. Tyrone Bowman live. Let's talk about this right now. According to the Washington Post, in an article written by Lauren Weber, the headline reads Oz confirmed to oversee health insurance for millions of Americans. This is sure to get somebody's attention. Don't forget, please kindly subscribe to Tyrone Bowman Live. We're on the road to getting 2,000 subscribers, and you know what? We're halfway there. So help us to make it across the finish line. According to the Washington Post, the Senate confirmed Mehmet Oz to lead the Centers for Medicare and Medicaid Services in a party line vote of 53 to 45 Thursday, placing him in charge of overseeing more than $1 trillion in annual spending, cementing his turn from daytime TV star to DC bureaucrat. Oz leveraged his position bona fides to waltz through the confirmation process and helm the agency that regulates health insurance for millions of Americans. The massive budget of Oz's agency makes it a target for efforts to cut government spending. Oz dodged questions in his confirmation over whether he would oppose cuts to Medicaid, the health insurance program for the poor. Republicans will be forced to weigh cuts to the program to meet their budgetary goals, reductions that could shutter rural hospitals and decimate maternity care. Let me tell you what's going to happen. He's going to do all that and then some. Over 70 million low-income Americans rely on Medicaid for their health insurance. Joan Alker, executive director and co-founder of the Center for Children and Families at Georgetown University, said there is plenty of reform for Medicaid that, quote, can and should be done, close quote, but cautioned against a, quote, sledgehammer, quote, approach for Oz. Mistakes are very consequential for the folks who rely on Medicaid, often for life and death services, she said. You know, before I read the rest of this article, let me tell you something. Politicians don't care. I'm talking about the heartless. Politicians don't care about the gutting of Medicare and Medicaid. You want to know why? Because once they become elected public officials, they get top of the line health care for themselves and their family. Let me say that again. They get top health care coverage for themselves and their families. So the heartless MAGA Republican leaders don't give two flips in a win about the average person who suffers from medical conditions, sickness, disease, and want and need. They don't care because they feel as though that they can unjustifiably do whatever they want to do at the expense of everybody else. Everybody is affected by this. Everybody. The cardiothoracic surgeon also did not address concerns over multiple potential conflicts of interest he may face as head of CMS, including questions over a health benefits company he co-founded with his son, his prior advertising with weight loss drugs, and his history of endorsing supplements. As head of CMS, Oz says he will focus on Health and Human Services Secretary Robert F. Kennedy Jr.'s agenda to, quote, listen to this crap, make America healthy again. Everything is about make America great again, make America white again, make America healthy again, blah, blah, blah. It's always make America this again by focusing on preventive care. The deeper promise that we should all be making to America is we're going to make it easy for America to do the right thing when it comes to their health, Oz said in his confirmation hearing. Oz has a real opportunity. Well, how about you stop all those cheeseburgers and hamburgers and stuff going to the White House every day and eat real healthy food? Oz has a real opportunity to improve America's health with investments in preventative, primary, and value-based care that he and the Kennedy team have indicated could be on the table, said and Perech, the chief medical advisor at the Bipartisan Policy Center. If CMS wanted to be, they could be the most important prevention agency at HHS, Parika said, pointing to ways that could invest in saving money on preventing elder adult falls or focusing on other chronic care services, quote, close quote. Republicans are thrilled with Oz's health credentials, with one Republican senator saying it was a blessing Oz had lost his Senate race in 2022. We are all very fortunate that you're not sitting on this side of the dais, but you're sitting on that side of the dais, or whatever. Senator John Crone from Texas said during Oz's confirmation hearing in March, what you will be able to do in your new capacity will outstrip anything you might be able to do as a legislator. Oz will take the helms amid a tumultuous time for America's health agencies. HHS laid off thousands of workers Tuesday. Listen, they laid off thousands of workers this past Tuesday as part of a projected 25% reduction in force announced by Kennedy last week. How is that making America great again? How is that making America healthy again? By firing people. That's what it's, forget about this term laid off. No, it's called being fired unceremoniously. One of Oz's first challenges will be deciding whether or not to add his agency's bottom line by expanding the approval of the use of weight loss drugs, which could cost the federal government an additional $35 billion between 2026 and 2034. Oz has previously sung the praises of such medication, while his new boss, Kennedy, has been an outspoken critic, saying in October, they counted on selling it to the Americans because we're so stupid and so addicted to drugs. You've got politicians who take more drugs than anybody. In his confirmation hearings, Oz promised to police upcoding in Medicare Advantage plans. Medicare approved health plans offered by private companies, considering his prior efficacy for expanding access to the program. There's a pack of lies. And of course, the Washington Post, they're going to slant the story in favor of the Republicans anyway. Never surrender, never quit.